Thank you, Tammy. And I think you'll be glad to know I'm not doing patience or whatever it is now.
Thank you. That's another gift for me. So
Good. Okay. But I am doing another important topic that I don't think we've done before. And it's come up a lot this week. I'm in LA this week with our clients, which I always love because it's like more in-person, hands-on stuff. But I want to talk about validation and understanding validation and what that's all about, because I think so many of us, and I'm speaking as addicts, but people in general, I think, really start to seek validation, and it can really turn unhealthy. So I kind of want to talk about what it is, what unhealthy validation looks like, but more important, what healthy validation looks like. So what I first wanted to say, it's natural to seek validation. That's a human thing. That's not a bad thing. That's not pathological. It's normal that we seek validation from those around us. We want to be, reassured that we're doing a good job, that we have a good talent that's been recognized, that we know that we look good, or that we're a good person, or all that's perfectly normal and fine, right? That's a good thing. And that feedback can be used to kind of bolster our sense that we're okay, that we're kind of on track, that we're living in integrity, and we're kind of in our zone, and we're doing well. But what happens often with addicts and partners for that matter too, is that we have these beliefs, core beliefs, that somehow we're not so okay, that sometimes we have beliefs that I'm unworthy, or I'm unlovable, or I'm misunderstood, or there's a little bit of negativity in some of our self-concept. And so that when that happens, we start to doubt ourselves. And when that doubting hits a certain level, we start to say, well, maybe I can get reassurance from outside myself. And so we start to seek validation externally. And that's where it can get kind of go off the rails, because we can start to seek validation in all kinds of ways that are unhealthy. And we can also start to create what's sometimes called a false self. So if I'm not feeling good about myself, one strategy that's very common is to okay, let me change things that I can change to make me look good on the outside. So maybe I'll go to the gym and buff up, or maybe I'll get a certain kind of car that's, the right brand to drive, or maybe I'll wear the right clothes, or have the right zip code where I live, or have a good income, or whatever, all these external things, and thinking that'll make me feel better and get the validation that I want, that will finally fill that hole that we feel inside. And yeah, we get a lot of validation, and sometimes that works. People say, wow, the great clothes, great car, great body, whatever, great trophy husband, trophy wife, whatever we do. The problem is, despite we could have all the compliments in the world, all the validation in the world for those external things, if we don't believe it in the inside, that validation doesn't get through. And so it feels hollow. We see this all the time with our clients in group. Somebody will say something nice, somebody say a compliment, and I'll ask the client that was directed to, can you receive that? Can you feel that? It's like, no, because it doesn't resonate with how I really feel about me inside, because I feel that I'm unworthy, that I'm unlovable. And if somebody says something nice to me, it doesn't resonate. So this is a real problem with addicts, but with people in general that seek to get external sources to make us feel good, or to know that we're okay. And so we need to figure out how to correct that, and not seek that validation from the outside, from the external, but really learn how to generate it from the inside. And again, when we're healthy, when we're in a good place, there's nothing wrong with seeking a compliment, right? But when we need it to kind of correct some deficit that we feel about ourselves, that we're really not okay, but I need Tammy to really reassure me that I am, that's not a good dynamic. So how do we go about validating this? And there's a couple of different things. One, to heighten your emotional awareness, to really start getting in touch with feelings. What am I feeling about myself and about other people? And am I feeling happy, sad? Am I feeling it all? One of the hallmarks of addiction is that we get numb, we get disconnected from our feelings. And so we have no compass, we have no emotional compass to kind of guide us and let us know what's going on. And remember, feelings are the primary information source that we all have. They're a dashboard of gauges and dials that tell us what's going on with us. And if we're disconnected from that, we kind of are operating blind. We're flying I'm using so many mixed metaphors, flying in the dark, flying through fog, operating blind. How many else can I mix up in there? But you get the idea. But so then what do we need to do? We need to like get reassurance from other people. And that gets, first of all, old for them, and it doesn't really work for us. So I think the more sense we can get of our feelings, the better. Focus on the present and not on the past and future. A lot of this need for validation is really driven by our beliefs about ourselves in the past, or our worry or anxiety about what's going to happen to us in the future. If we can say right here in the moment, almost always we can kind of reassure ourselves that we're okay. You know, am I worried about what's going to happen tomorrow? Yeah. But right here in this moment, am I okay? Yeah, I'm okay right now. And I think to kind of bring us back to the present time is a really great tool for all kinds of reasons, but for this validation thing as well. Start to look for validation sources. I think we get a very narrow viewpoint. Look for validation sources besides like what you do, but more for who you are. What kind of person are you? You know, what are your values? What have you done in terms of service? What do you do for other people? Are you a kind person? Have you been helpful? Generous? You know, these kind of values that we give lip service to sometimes. But I think really start to look at that and correct it. And the steps give us a really handy and useful guide. You know, when we go off the rails, if I say something, you know, unkind to Tammy, I have a format and the steps to go back and make an amends and make an apology and try to make it right. And so I think we have a way to correct it, because we don't do everything perfectly, but it gives us a guide to be able to kind of do that. So to find sources of validation outside ourselves, to take actions that promote self-respect, you know, and I think all of us as addicts, I would not call our life as an active addict one of self-respect. I mean, that's probably as far away from that life as possible. So I think one of the goals in recovery, even if I'm still working on myself in a big way, I can still have a self-respect that I'm making every effort and I'm living in integrity. And so I think, and that self-respect is a huge source of internal validation. That's one of the key sources to let me know, hey, I'm okay. I'm doing okay. I may not have all the, you know, ducks in a row from the consequences of my addiction, but I'm working on it to the best of my ability. And I'm working on it with good faith and good effort. So really trying to live consciously with integrity is really important. This is one I think that people miss all the time. In terms of promoting internal validation, really recognize your own gifts and talents. You know, I think everybody is gifted with different skills, different talents, different things they can use to contribute to the world, and or their job or whatever. And I think we often overlook those, and we see other people's talents and gifts, and we kind of somehow compare ourselves and think, well, they have that, but I don't have much. But I think if we can recognize ourselves, it really helps to move past that thing, well, I'm unworthy, I'm unlovable. Well, no, I'm not, right? We can do those affirmations and correct those beliefs. We can also start to recognize, how am I different? What are my gifts? What can I contribute to this world that maybe somebody else can't do as well? So I think that's really important too. And then maybe most important, really to pay attention to self-talk, critical self-talk. That's that chattering in our ear, that's hardwired negative voice that is always just criticizing us and undermining us and just like, you know, who are you to think you could do that? And boy, what an idiot. You always make it just blah, blah, blah. We really have to identify it and turn it down and turn it off, and better replace it with positive things, replace it with affirmations, replace it with positive self-talk, replace it with gratitude. Because when we're in a space of gratitude, it automatically puts us into a more positive mindset. So, and then that also, by the way, if we're focusing on gratitude, it means we're focusing on what's good about us and what's good about what we have and what's good in our lives, not what we're missing, what we don't have, what we've done wrong, you know, all that negative stuff. And I don't mean that we don't need to take responsibility for what we've done, but we also need to focus on what we have done that we're okay. And then finally, I think, you know, we ask our clients to do affirmations almost every day. We need to really rewire the beliefs we have about ourselves. You know, those old core beliefs that I'm unworthy, I'm unlovable, all that stuff that just is a lie. It's not true. And I think we have to really change that. You know, I'm a strong person, I'm a survivor, I'm a good person, I'm a lovable person, I'm a worthy person. Whatever the case may be, we really need to repeat those. And remember, with affirmations, it's not good to just say it once. It's good to write it down, put it on a Post-it note, put it on your mirror somewhere where you see it, the refrigerator, and just take it in every day. Just let it seep into your brain until it becomes just part of your wiring. And I think, the final thing I would say is just to really celebrate your strengths and your values. I think as we move through recovery and start to live in integrity and start to discover our values and live according to our values, that's something to really celebrate and to really notice and to take good note of that in terms of our own worthiness and validation. So I think just making that shift from moving from the external to the internal and really working on how to generate that from inside so we don't need it. We don't have to have it from somebody else. So I think I'll stop there. Thank you.
That was really great. I wrote down recognize our own gifts and talents and right size, because I think it's easy to go, oh, I'm not as good as, but it also can be, well, my car is better than, my house is better than, my partner is, so having the right size, because there is, and I mean, I know for sure that internal message of if they only knew what I was like on the inside, so there's always this facade that we're putting in. So having the internal, recognize, like you said, celebrate your strengths and values, know what your strengths and values are, like we talk, often about, 12 step. Well, we do a searching and fearless moral inventory that includes what are our strengths, like we will get a better picture and clarity on who we are, and we're all human. So there is, there's the things that are, and what I always think is so perplexing is a lot of my strengths are also my weaknesses, I mean, like they're finding the right balance so that it is a strength rather than, than a weakness. I am pretty self-determined. Well, that, if I forget to ask for help, I mean, that gets me a long ways, but if I forget that I need other people and I need to ask for help, it gets me in trouble. So it's one of those, the yin and yang of it, I guess, is what I'm thinking.
But the self-knowledge to identify both those sides of that same thing, right? And to take action accordingly. Yeah. Beautiful.
And I don't swing on the pendulum like I used to, because it, it used to be all or nothing, and now I just kind of go, oh, I'm a little out of alignment, so being able to attune, but, those are the gifts of recovery. The focusing on the present, I think it is easy to do the compare unfavorably or over favorably or whatever, but in this moment, am I okay? Sometimes it's writing a list of, in this moment, what's the reality? I think it's really easy to get that distorted lens, so what really is, going on right now? What is the reality? Talking about it, getting feedback, it, can be really helpful too. Validating in and of itself, but perhaps external, but if you're sharing it with somebody else, they're helping you get perspective.
No, we can't live isolated, right? We need that feedback for sure.
Yes.
Healthy reciprocal conversations, not one-sided. Tell me I'm great.
Yes. Don't you love my car?
Right, exactly.
And I really do appreciate, I mean, obviously, I'm well, not maybe to obviously some of you may be new, but I am in recovery. The 12 steps, saved my bacon. It's one of those where I don't think consciously about what stuff I'm doing. They have become part of who I am. Now I can stop and go, okay, I'm doing an inventory right now, I'm whatever it is I'm doing. But they are, part of who I am, but, being able to live in integrity and to not need, it is always nice to hear, the attaboy, attagirl, but, but I care more about, am I living, in my integrity? Am I living true to my values? And if I make someone upset, like if I'm legitimately in the wrong, I want to clean it up. But if we just don't, mesh, that's okay. I am not, completely annihilated by their dislike. They are entitled, so they it is who it is. So, okay. We have some questions, Dr. David.
Cool.
First one, betraying spouse says his LPC is telling him not an addict to porn or sex, but the recipient of a lifetime of layers of trauma and abandonment. My therapist feels he has an addiction and preoccupation with sex, as well as a CSAT I have shared with. He refused to see a CSAT, saying we need marriage therapy, not sex therapy. So a CSAT is not sex therapy.
Right.
A CSAT is sex addiction therapy. I want to be really clear, because sex therapy and sex addiction therapy, there are some, like, Dr. David, Dr. Robert, trained in both, but that's an even smaller layer. So, okay, now he is pushing me to a decision if we're going to come back together, or I should set him free to maybe find someone else down the road. Any thoughts on how to deal? Wow, sorry. I'm so sorry.
So it's very common, if not nearly universal, that adverse childhood experiences, trauma events are part of the early lives of many addicts, right? That's a very common story. It's not the only way, but it's very common. And it's very easy sometimes to avoid the harsh reality of an addiction diagnosis by pointing to all the terrible things that happened to me, putting myself in that person's shoes, and saying, look at this, I'm more of a victim here and a trauma survivor, and I need to deal with that. And my behaviors all stem from that. And it's true that addictive behaviors may be related to that, but the solution for those behaviors, whatever they look like, is not to go back and dig around in trauma therapy. The solution for staying sober is to work on the trauma therapy, but that won't work until the addiction is addressed. And so I'm sorry for the situation, because my belief, and I trust the assessment of these other therapists, is that this person certainly sounds like he has an addiction and really needs to kind of start to look at that. And I don't think that blaming trauma or throwing down demands or statements that, well, maybe we should just, cut each other loose, is going to really help, because that, he's going to take him with him wherever he goes. And I think this behavior is going to continue until he really faces the real problem. To me, this sounds like just kind of another form of denial, where people just kind of get into the stance of pointing to other things to distract from the real issue because they don't want to see it and they don't want to change their behavior. So I do believe, I hope that maybe he can start to see the reality there. I'm not sure what licensed counselor. We do see, and this happens sometimes, as Tammy said, there's different kinds of specialties. The certified sex addiction therapists are really specially trained to identify this problem. I'm also, as Tammy said, a sex therapist, and it's a totally different approach. And I'm both, and I can tell you the sex therapy if you go by that training alone, it just misses the boat totally on addictive behavior. And if you don't have either of those and you're operating from just a counseling standpoint, it's very easy to interpret addictive behavior as this is just a pained response to these earlier life events and stuff. I think it's a huge disservice, frankly, and it's just a difference of opinion. We've seen many clients come to Seeking Integrity who spent years, frankly, being kind of misdirected by well-meaning counselors and therapists who just didn't understand addiction. And that's a very sad state of affairs. And I would hate to see this person get caught up in that. But just because a counselor says that's what it is, I think I would check it out with maybe another CSAT, perhaps, to get a second opinion, or encourage him to try to get a second opinion, because I think he's being steered in the wrong direction, and that could really be harmful to everybody, including his family and you. So I hope you can maybe at least get a second opinion to talk about it from somebody who's qualified to assess for a sex addiction. That would be a CSAT.
So I'm reading this a little differently. I'm reading that, first of all, the betraying spouse is seeing a person. Most therapists truly do not have training on addiction on any level, and even fewer have the certified sex addiction therapist training. So I used this earlier today on another webinar, but it's like going to your general practitioner, your who's able to give you the general checkup. He discovers you have cancer. He would refer you to a cancer specialist. He wouldn't. You don't want your general practitioner to treat you for something that's, highly specialized. So I'm also suspect that he says his therapist is saying, like addicts lie. So I'm highly suspect of that. But I want to go to the end of this, because I think you have good information from all of these other professionals. But I hear he has refused to see a CSAT, saying you don't need marriage therapy. If you go to marriage therapy, he's going to lie. Yet, so when you say now he is pushing me to decide if we are going to come back together or I should set him free. So I'm going to ask you, what do you want? If he's refusing to do anything to help himself or help you in the relationship, I'm almost wondering, do you need to be set free? I'm so sorry. I'm going to just flip this completely around and have you, rather than, he wants to be set free. Do you want to be in a relationship with somebody who's, blame shifting, that it's the relationship, it's you, it's whatever. And, and it's still going like, yeah, I want to continue to do all this stuff because, hey, all this bad stuff happened to me a long time ago. And I'd rather, lean into the problematic behaviors than get the help that I really need to be able to be in a relationship with you. So I would invite you to look at, what do you need as a betrayed partner for your healthy boundaries, for safety, for you, for physical, emotional, financial, to look forward. And if you want to stay in this relationship, all good, but what do you need to do to take care of you? Because nothing you did or didn't do created this situation, and you can't really do anything. You can take care of you, but you can't you can't fix him if he's completely unwilling to do anything. So I would invite you to, rather than he wants to be set free, do you need to be tethered to somebody who is not able to participate in a real relationship with you? Just a thought.
I agree, Tammy, totally. And I'd just like to clarify also just how marriage therapy fits into some of this scenario, at least my thoughts. I think marriage therapy is also another specialized modality, right? And I think oftentimes my idea of the ideal scenario in the recovery from sex addiction would be the addict and the betrayed spouse both having a CSAT, both doing their individual work for a period of time, probably up to the disclosure. And that could be 3 months, 6 months, whatever. And then working on the disclosure. And really, I find after that point is the most ideal point for marriage therapy or couples counseling, because at that point, both parties have done a lot of individual work. They've hit a certain point. They have a lot of insight. They've come to an understanding. All the cards are on the table. And at that point, a marriage counselor or a couples counselor, what they do, their client is the relationship. And at that point, the couple, in my opinion, is ready to start working on that relationship if they've decided to heal it and go forward with it. And so the couples counselor can bring in communication skills and all kinds of stuff that will be really helpful at that point. I think at an early point, if people are still in the early stages of recovery, whether you're the partner or the addict, it's really hard to have a good couples therapy session because people are so reactive and people are up and down, and often they're not on the same page and they're unable to really hear each other clearly. And so I think there's a time and place for couples counseling, but a little bit down the road in recovery, but it's not the same as addiction therapy. It's not the same as sex addiction therapy. It's not the same as sex therapy. All these things are very different. And it's important to understand that.
And I agree. And the couples therapy, you want a separate couples therapist or both of your individual therapists doing conjoint couples therapy, because the relationship is the client.
Right.
And I hear too often of people that are using one therapist for all these different things. And, it ends up, especially, addiction is about poor boundaries. And other things too, attachment wounds and whatever, but, lack of boundaries is a problem for addicts. If we had good boundaries, we wouldn't go act out, we'd go, oh, that's not a good choice, but we, that isn't what we're thinking, so having a therapist that, so with addiction, it's cognitive behavioral therapy, accountability. I mean, there are specific proven techniques for dealing with addiction. Yeah, for depression, it's different, so for whatever, and can addicts have depression? Sure. But stopping the problematic behavior, is really key. And some of the depression, unless you're clinically depressed, will go away if you actually work on, the problematic behavior. So again, going back to, you want the right specialist, for this, and doing, I often say it too to people that are calling looking for a marriage. They're looking for couples therapy, and I'm like, are both of you on a good path? Yeah, and half the time, at least, it's like, oh, we just had discovery, 3 weeks ago, and they are hoping that a marriage therapist can help them, but all the problems, all the lying, is still prevalent. Somebody used this analogy, and I wish I remembered who it was, but they said going to couples therapy, too early is like rowing a boat with one oar. One of you is showing up and paddling like crazy, the betrayed partner, and the other person isn't. And so the boat just goes in circles. And I think that's a really good visual of, yeah. And I've had a lot of people that go, oh, we've been going to marriage therapy for a year or two, and we're really stuck. Nothing has changed. And because the foundation components haven't happened yet. So doing things, it's very specific work, and that is why leaning into, so thank you for being here. Thank you for asking these questions, but, really, following, a path that has been proven to work, will give you better results. But if you're the only one rowing the boat, the boat's going to just go in circles. So, okay. So next question. My partner, SAPA, works in a high intensity adrenaline job, surgeon. How many surgeons? And I mean, yeah, there's certain fields where like it is ER doctors, surgeons. Yes. He has acted out at work for many years. I see him now repeating the same patterns of disconnection, obsession, escalation. I would see an active addiction every 4 to 5 weeks now. Yet he says he's sober. There it is again. He says he's sober. It's actions. My question is he addicted to work? Can he do his job and remain sober, or lead back to secret one-to-one teaching junior female doctors masturbating at work porn? Oh goodness. We often have people come to treatment after their license gets in trouble. So It's problematic. So please talk about this, Dr. David.
Right. So first of all, this gentleman fits the profile, as Tammy said, of, high intensity. When we talk about sex addiction or porn addiction or chemsex addiction, we refer to them as intensity addictions. Those sex, porn, and amphetamine drugs are what we call super stimulants. They generate more dopamine and more intensity than any other substance on earth, basically. And it just is this unnaturally high level of intensity that nothing else can match. And so that's what makes it so highly addictive. But what happens when people engage in those behaviors, first of all, who's drawn to those kind of behaviors? Those kind of personalities that are drawn to that intensity. So we see surgeons, we see Wall Street traders, we see ER docs and other kinds of people who, and then by the way, their hobbies are usually rappelling or bungee jumping or high speed, risk skiing or something. It's all about risk and intensity, right? And then one of the things we do also when we're doing discharge planning with our clients here is we look at work, because work is the single biggest factor. When people get into recovery from sex addiction, what do they do for a safe outlet for all that intensity? They dive into work, which is socially, acceptable. It's like, look how hard he's working, but it's not healthy. And so there's a couple risk factors here, just in his occupation and the number of work he's doing. All that aside, right? And that's all true. But what I'm seeing here is a really dangerous pattern where he's still caught up very much in this active addiction pattern, and you've identified it, you've nailed it, and he's just in denial about it and doing the blaming and lying and shifting. And that's all a bad sign, right? That's a real bad denial. And I can tell you these cases usually don't end well. They usually end up with a board action. They usually end up with license intervention and bad things happening. So I hope somehow he can see that there might be a problem and that can get some assessment or help for it, because this is a kind of a fast track to bad news. I will say that sometimes people who have these kind of high intensity personalities and high intensity jobs and get caught up in sex addiction have to really look at their occupational choices once they go into recovery, because they find that walking right back into that high intensity place where, and especially a surgeon, kind of king of the mountain, right? He's all this authority and validation and prestige and control, which is another aspect of sex addiction, feed right into all that. And it's a very unhealthy environment. We've had docs who actually had to go. It's ironic what you said at the end there, because they've had to get out of the surgical suite, out of the ER bays and back into teaching because it was less intense, and that's all they could do without risking their sobriety. But teaching, if you're teaching co-eds and females, that's another problem. So I mean, there's all kinds of like landmines in this question. But I think the bottom line is that he really needs to address the addiction. And unfortunately, there's usually a lot of ego with these guys, and I think he's probably got a huge denial system and maybe an ego to match. And I think he's going to put up a fight. But unfortunately, sometimes it takes the threat of a loss of a license or a job. And as I'm thinking, Tammy, of the physicians we've had that came through here, it's almost always been that they lose their job, or they lose their license, or there's board action, or there's legal
because they wait too long. Yeah, exactly. Like it's, and we've had some where there isn't legal action yet. But in a hashtag Me Too world, do you think these junior female doctors are going to continue to be okay with this? This is going to get reported, and at some point, the hospital or the practice that the person's affiliated with is going to say too high of a risk, and those things are reportable. Or somebody's going to walk in on him masturbating at work. I mean, like this is experience. This is not making a fearful thing. So I'm going to back up again. I'm going to flip it. You're a betrayed partner. What do you need to do for your healthy boundaries, for your financial? If he crashes, I think you said husband. So if he crashes and burns, what do you need to do to protect your assets? What do you need for your physical, emotional, financial sake? Because unfortunately, we have had, where a partner, is like all of a sudden devastated because, all of these things are, negative things are going to happen. So I hope he gets help. Anytime I read, he says, I just go, what are his actions showing? And his actions are showing he's going back to the same problematic environment. So he's setting himself up for acting out, even if he isn't acting out yet. To me, what I'm reading is just a matter of time. So I would implore you, healthy boundaries for you, take care of you. Get assets set aside, so that you are taken care of regardless. If you have kids too, I mean, it's like, I won't tell you the horror stories because they're bad, but I'm telling you, take care of you, take care of your family.
Get an attorney, because
yes, thank you.
Take all the assets, and the wife and the kids' assets go with it. So protect yourself.
I feel like Debbie Downer, but I'm, it's just like, and it all could have been prevented had he just gotten help in time, so please take care of you. And okay. Next question. Could you speak to validation of betrayed partner's feelings by the sex addict?
That's great. I think, validation from the betrayed partner's point of view is also equally important, because I think what happens from the point of view of a betrayed partner in that process of an active addiction, well, they're constantly being undermined, right? All the self-esteem, the sense of, the betrayals that occur, the constant questioning of their bodies, of their sexuality, of their looks, of fearing them being compared to other women, just wondering what their husbands are thinking or looking at when they're out with them. Just this constant reminder that they're never sure of what's going on. And I think talk about needing validation, then it's actually the opposite, right? They're constantly questioning themselves, if they match up and what's going on and what have they done and all that blame. And unfortunately, as we've seen in some of the questions, the way they've been worded tonight, one of the behaviors that we see addicts do is blame. And so that feeds right into the self-doubt that the partner takes on, right? In terms of just that, the worthiness and all that. So there's tremendous damage that's done to the partner in terms of how they feel about themselves, how they see themselves as women, as emotional beings, as sexual beings, as just as partners, as mothers. I mean, everything gets affected by this. And so I think seeking validation in a healthy way is going to be really important. And I think one thing that we find, and Tammy's mentioned boundaries a couple of times tonight, it's so important to understand, where do you need to get validation and how do you get it? My point earlier was to talk about internal sources of validation. I think that's critically important. But I also know that early on, when there's this betrayal trauma that is very common, if not universal, with partners, it's really almost impossible to generate that kind of internal betrayal sense of validation on your own, right? Because we were talking about some of those healthy things, and if I read down that list, it's really hard to think about somebody in early recovery, at least in betrayal trauma. Now, there are certain things you can do. You can take actions that promote self-respect, right? So setting healthy boundaries, understanding what are my needs, speaking as a betrayed partner. What do I need to make myself feel emotionally safe, to protect myself financially, to protect my children, to protect life going forward, And I think just setting boundaries also then starts to promote self-respect, because that's helping with that. To live consciously, right? As not always reacting, but to respond. And reacting implies kind of an automatic choice that we do as part of the addictive process. Responding is more kind of conscious choice of like, no, I'm not going to respond emotionally. I'm going to respond based on what I need right now, and setting a boundary or whatever that means. But all that said, I think early on, there's so much negative critical self-talk generated inside the betrayed partner that it's really important to have external support. And I know my opening message was that relying on external validation isn't so healthy, but I think in the beginning, we need that, as whether you're an addict or a partner. And I'm thinking a betrayed partner especially needs support. What is my first question when I meet with an addict here or anywhere? And when we're talking about their partner, what kind of support does she or he have? Do they have a therapist? Do they have a support group? Are they linked up? Because, unfortunately, very often, sometimes partners are at home, stuck with household things and the kids and no support at all. Well, they continue to ruminate about what just happened and trying to figure out what the heck their life looks like right now. And so that support is essential. So I think I encourage people, Seek and Trade, I think, has done a great job doing all these free online support groups. So I think all that is essential. So in terms of getting validation, I think in the beginning, at least, it's really difficult for a betrayed partner to generate that themselves. And it's okay to receive that and ask for it and receive it from other people, other trusted people who've been there, right? The recovering people. What you don't want to do, well, let me back up. What you do want to do is vet your sources. Yeah, I think it's to continue going back to the same poor source of validation, like the addict, hoping this time it's going to be different, and that this time it'll work out differently, is a bad choice, right? I think I would put a boundary in yourself to not do that anymore. Start seeking validation from healthier people. But again, I think the goal is to start to be able to generate that internally. And that comes from setting healthy boundaries, from taking care of yourself, from meeting your needs in a healthy way, from starting to feel good about yourself and have this sense of taking care of yourself. But in the beginning, I know how difficult that is. And I know that it's okay to rely on people. We have an expression in therapy when we're talking about a group, and it's that the group itself, the community, carries someone. They hold the space for that person until they can carry themselves, right? So we do that. We support each other until someone can find their legs, if you will, and support themselves. And then we do it for other people once we have it. But that's what recovery is all about. So we need that connection, and partners need it as much as anybody else. But I think that's what I would go for, is just doing things that are affirming for you, whether it's boundaries, taking care of self-care, taking care of yourself, not indulging in a lot of rumination, self-recrimination, all that stuff. And then just really connecting with healthy people who are going to feed the good side of you and the side that needs healing and recovery and support. People are very vulnerable and fragile in early recovery, and they need that support. They just need loving. Sometimes they just need to be listened to, right? I think a lot of us just want to be heard and witnessed, and maybe that's all you need. And that's fine. That's a totally legitimate need. But I think it's important to find safe places where you can get that, and it's out there. But we need to pick very carefully.
I ditto everything you're talking about, and early on, an addict, and it's not just sex addicts, it's any addict, can't tell a feeling from a flea. I mean, we don't get it. We don't know. We've stuffed those down so badly, numbed them out, done, escaped from them. So yeah, as a betrayed partner, do you deserve validation from a sex addict or any addict? Absolutely. Is it going to produce the right results for you early on? No. I often talk to people about there's kind of phases. Abstinence is just stopping the behavior. And people will go, oh, we're in recovery for, 3 weeks. And I'm like, probably not. There may be stopping the problematic behavior for 3 weeks. That's abstinence. I had a friend, well, he still is a friend, but he's a therapist, and he said the first 90 days is just abstinence. So he wouldn't even let people say that they're sober until day 91. I said, "Ooh, that's harsh, because I want every day to count," But he was like, "No, the first 90 days is just abstinence." And I was like, okay, so there's a period of time where you're just not doing the behaviors. And for those of us in recovery, we're like, yes, I just didn't do that behavior. I'm so excited, one day at a time. But for betrayed partners, that's like compared to the last 3 decades when you've been doing all of these horrible things. So then I talk about, and there's some sobriety, and I look at that as, okay, starting to not just abstinence, starting to get a clue, but sure not on the recovery path fully yet. That really takes time. I mean, you're probably looking, I know for sure, over like 12 months. But I always, well, my experience is kind of 12 to 24 months. I see people really kind of getting it so that they're able to incorporate those things into their all over life. It's, like I talked about a bit ago too, it's like, it's part of who I am and what I'm doing. It takes time. There's, we're at, kindergarten level, and recovery is, many years beyond that. So for a partner who deserves to be validated, a betrayed partner, expecting somebody who has no emotional EQ to be able to to step into that space when they're going to be defensive and everything else is not going to be helpful. So somebody that's, if you're a couple of years into this and they've really done their work and you've done, then they should be able to, you should be able to see them showing up and be able to have the communication tools, the check-ins, all of those things to be able to validate each other, and support each other. That's part of the recovery path, and it's worth it. And it happens, for those that are doing the work. But, we have betrayed partner groups on sexandrelationshiphealing.com, and those partners are amazing and validate each other, and,
Right.
and take in that, should your betrayed, the betraying spouse, step into that space, sure, but they don't know how yet, but it's okay for you to say, I visualize a day when you'll be able, this is what I need from you. I know you can't do that yet, but I'm holding space for that so that you can. But I'm just telling you right now, this is what there's so many techniques to be able to start articulating that helps you, so that you aren't, in I call it the spin of like all of those, those emotions. Been there. So learning to have grounding tools and learning what I need to do to take care of myself. Can't depend on an addict to do that. What can I do for me right now? Call a friend, ground, you're here, yay. But have those, in my back pocket. So I have the ability to do that. But if the sex addict is doing the work, I mean, really doing the work, there will be a time. So hold out hope for that as well.
Right. Right.
Okay, next question. Oh, why don't more therapists suggest leaving the SA partner who has been seeing sex workers and opening the spouse to disease? It seems that like the industry is heavily skewed to telling partners to stay. I don't think they tell partner. I mean, I hear both, but everybody has to make their own decision, and somebody telling you what, I mean, that's not what therapy is really about. So, Dr. David, can you speak to this, please?
Yeah, I was thinking about that. One of the central tenets of therapy, no matter what kind of practice or modality of therapy you implement, is to really start where the client is at. I think, I don't know any therapist that kind of presupposes what's best for a client or a couple, but we listen and try to work with what the couple or the client wants. And in my experience, even in the kind of worst part of sex addiction, most couples, at least in the beginning, want to try to give it a shot. They maybe by a thread, right? Maybe just hang in there, maybe the last chance. We've had many clients come to us and their wives have said, look, this is your last chance, get it right, or it's out, I'm over. So I think I would say that's not so much being driven by the therapist themselves as the client's intention. I think the other thing here about, do sex addicts do bad things, and they go to strip clubs and they see prostitutes and they do all that stuff. And not to excuse that, but that is part of the addiction, right? And I think that is not any kind of behavior I condone or that anybody condones, but I think we look at it as part of this acting out behavior that is something to move past in recovery. And the addict needs to take responsibility for that and the consequences of that, by the way, on himself and on his partner and on the family, and see if they both as a party and as a couple can come to grips with that, with laying it all out on the table through the process of full disclosure, and then make a decision. Is this going to work or not? And can we try to heal and repair or not? But I think that's not so much driven by therapists as it is by the intention of the couple. And, I've seen every permutation of that. I've seen the intention to stay and a disclosure and then a divorce. I've seen, people coming with the last straw and it keeps limping along for a while after that. I've seen people come in with the intention of, we really want to make this work. So it's all over the place. But do we see all kinds of bad behavior? Yeah, of course. And I don't think at least it's not my intention to kind of condone that or indirectly condone that. But I understand that kind of goes with the territory. And I think everybody understands that. And we kind of try to move past that. But I think the central tenet here is to really start where the client is and see what they want. And I think, frankly, by the time somebody gets to a place like Seeking Integrity, there's been a lot of self-selection anyway, right? I'm sure there's been a lot of discussion about, do we want to do this? Is this the right path? And there may be couples that decide to split or go away, and we never hear from them. So that's a whole other group of people. But at least among the people we see, there is some intention to at least make it work. And as I say, it may be hanging on by a thread, but that's the intention for the most part. And so that's where we start, and we work with that intention and go from there.
Yeah, and I was thinking, just getting rid of the addict doesn't fix everything for the betrayed partner. I mean, there still is, grieving the loss of the relationship, grieving the loss of who I thought he was or she was, so all of the baggage for the betrayed partner is still there, even if the addict isn't there. It's not, out of sight, out of mind. All of those hurts and wounds are still there. So giving space. I was thinking, I had two people I talked to just today, but one of them, talking about, it was a male addict, but he's a really good person, and then there's this, and that's the case. It's like, it isn't, of course, because if it was all they're horrible monsters and everything they do is awful, A, you wouldn't have been with them in the first place, and B, it'd be really clear they're out of here.
Pretty
But I
black and
also
white.
think, yeah, and this is that messy stuff where there's a lot of good and then there's a lot of brokenness, and the brokenness is the stuff that can be healed. There will, it isn't like, I mean, you put Gorilla Glue on something, you'll still see the crack. But we talk about too, it's like with if you break a bone, where it heals is where it's stronger. So you can heal yourself and you can't heal yourself. You can get help to heal, and the relationship can heal, and it can be stronger in the spot where it was, the most broken. Because if you're doing the work, then there's honesty and and communication, eyes wide open, moving forward. That this isn't all going to be magically better. I hear that sometimes partners going, "I want it to go back to the way it was," and I, with all due respect, no, you don't. Your partner was lying to you. It was a facade. So while it was comfortable,
Right.
it wasn't the safe space you thought it was. So to me, having an eyes wide open, here's the journey that we're on. We've gone through, this messy, awful stuff, but now we're getting to a point, I know lots and lots of couples who find that they have a better relationship, more honest, a truer communication because of the recovery journey. So you get all the bad stuff and you miss out on the good stuff if both people are willing to move forward. But not every relationship is supposed to stay. I'm not, like Dr. David said, like everybody has to make their own choice. I think it's really telling. I think people have, their heart and their head can be saying different messages, and when they align, whichever direction they align, I think that's when people know, what their journey is. And if you decide to stay for today, you can, if it's good for today, you can, you can see how it plays out. And if 3 months later, it's still the same way, and you think, oh my goodness, I can't visualize this for 2 more years and I don't see any change, then maybe your head and heart will align in a different way. So I guess I'm encouraging my favorite topic, patience, having the ability to, to just slow the process down and not react, to the ability to take action rather than just react, getting valid support. But I would be, if a therapist is telling you need to leave, I think a therapist saying, why don't you make a list of the pros and cons of staying and going? Then we can discuss that. That to me would be a much more healthy approach.
Yeah, agreed.
Okay. As the betrayed partner, my therapist says no couples therapy right now. I told PA spouse, and he said his therapist said she would never tell 2 people who had been married so long not to do couples therapy. I'm not ready for it because he still is in denial of addiction. Any thoughts? I'm with you and your therapist. So
Yeah, I think it's a similar thing to what we said before. I mean, if somebody still is in that active addiction or in the where there's smatterings of that with blaming and rationalizing and denial and not fully engaged in recovery, I think couples therapy is just kind of a waste of time, because you're not getting really an authentic, honest response from the person, and you need both people being present in a really authentic way. So I also, as I said before, I think couples therapy is best down the road a little bit in the recovery process. And these questions are so illuminating about what differences there are among therapists, right? So you can go to different therapists and probably ultimately get the answer you want to get. But I think ultimately it's probably going to come down to what's right for you. But in my experience, I think a couples counseling too soon, or a couples counseling where there's any active addiction going on, is a massive waste of time. It's going to be frustrating for you. It's not going to go very far. And in fact, it might cause just more problems. So in the end, you have to kind of do what you need to do. But you have 2 therapists telling you 2 different things, which is an unfortunate situation.
And I reread it. I told my PA spouse, and he said his therapist said, and so I'm going like, I'm not 100% that the therapist actually said that.
No,
I'm like, that's a I love addicts, trust me, but I love addicts in recovery. And you said he's still in denial of addiction, so he's still in active addiction. And so when he's saying his therapist, if you heard it from his therapist, and especially if you have the ability to say, I'd love to do couples therapy, but when he's still in denial of the addiction and not willing to be accountable or work on it, we're not ready for couples therapy. But I'm I was flip about it, and I didn't mean to be, but when you say I'm not ready, trust that, you hold that. I'm not ready. Here's what I need to see from you in order to be willing to do couples therapy. But that's, you set your boundary. I would love to do couples therapy. We've been together a long time, but here's what I need to do to have that space be able, so I can trust that I can step into that.
And if I put myself as a therapist working with a couple who's been together a long time, of course, couples therapy sounds like a great idea, right? What's the problem? But also, if I'm listening to a client and clients lie, addicts lie, I may not be getting the full story about the extent of the addiction that's going on. And the active addiction there changes everything about the need for couples therapy and the timing for it. So I think, again, I'm underlying what Tammy said, just getting the story straight, or at least having that therapist have all the information is going to be an important factor, because he might very well, or she might very well change their mind about what they recommend for couples counseling. But I agree with Tammy totally. Go with your gut, go with your intuition on this one, because I trust that totally.
So we have two more questions. So we're gonna make sure we answer both these. My wife and I have days where we are really close, and then something that seems very small happens, and she reacts the same as if I acted out. It takes us right back to ground zero. I feel she gets close and then gets scared that I'm going to hurt her again, and she finds something that it used to prove it. I'm blame shifting, or does this sometimes happen? I think so. Does that make sense?
Yeah, I think what I think you're describing here is just a pattern we see often in recovery, early recovery especially, where there's still some partner trauma that gets activated, and little things can happen. It can come out of the blue. It can you can say something well-meaning that can activate your partner and have a reaction that's unintended. So we do see it. I think the best way to deal with those things is to use them as little opportunities to go back and once you're not in the moment anymore, go back and take a look at it and see what just happened. Let's talk about this. What was the feeling? What was your belief about what happened? What did you think I meant? There's a great Imago dialogue, the couples dialogue, that talks about communicating and just expressing what did I say? What did you hear me say? What did you think I said? Back and forth till you get the message right. But I think it's an opportunity to review and analyze and avoid and grow. So I think it's fairly normal. It's certainly not pleasant when these things happen, but if we analyze it, and figure out the patterns, we can make changes so they happen less and less. And I think they do start to decrease as the trauma levels decrease as well.
So I put two links in the chat. One is Dr. Eddie Caparucci has talked about some of the, it's about having the ability to be emotionally uncomfortable. I'm sorry that my previous behaviors have hurt you, that that I have left you in a place where you can't trust me. I'm working really hard I'm working on today doing things differently. I'm not going to do it perfectly. I'm going to continue to work on it. Repeat, have something, and talk about this. Like when you're not in that moment, like when this happens, how can we do it differently? Because otherwise it's the same dance over and over and over again. So we know this is going to happen, that something's going to trigger. And when you come at this, then I do this. And, so, you're doing the 2-step on this. So how can we say we need to take a break, and then come back together, or whatever it is that you need to do. But how can we talk about this in a different way? Do it together, have that communication. What do you need when that happens? What do I need when that happens, so that we can do it a little differently? So, okay, one more question. I'm having challenges as a betrayed partner with a cross-addiction husband early in sobriety. One, not be more his sobriety and recovery than he is sending him podcasts, articles, groups, and I educate myself during my healing. I've always been the doer in the relationship and need to stay in the back seat now. 2, other than continuing to work on my betrayal recovery, how do I remain patient for his action pace? that's a great question too.
Right. And I think it's very common for the betrayed partners to kind of move in and take action, right? And kick into high gear and try to do something to fix it or solve it. And I think you're going to have to really fight that urge right now. And I'd encourage you to take any momentum you have and kind of turn it back into self-care for yourself, taking care of yourself by going to meetings, getting support, talking to your sponsor, doing whatever you need to do to kind of take care of yourself, because the process of the recovery for the two of you is going to be different. We have a kind of a saying around here at Seeking Integrity that you both are on roller coasters and you're not on the same roller coaster. One person's up, one person's down, and it's kind of all over the place. But the trajectory, the pace of recovery is also different. And so what his recovery may seem kind of slow and frustrating is what it is. And you, I think, need to kind of learn how to take care of yourself. And I think Tammy just modeled a beautiful thing about how to kind of hold my own space, hold my own feelings, despite what's going on with my partner, right? And how to express that and saying, oh, this is what I'm feeling. And I know, whatever you're doing, I know you're trying, but this is what I'm feeling about this situation, and have those kind of conversations. But I think right now, there's nothing more you can do to control your partner, the addict. There's nothing more you can do to fix it or speed it up. It's a matter of kind of letting go and taking care of yourself and being supportive in whatever way you can, but not trying to take responsibility for it or any of that. Just good boundaries are going to be important here. And, knowing that the addict is has his own journey, and sometimes it can be very frustrating. But usually there is forward trajectory and forward motion. So patience, I think, too. That's Tammy.
And the only other thing I'm going to add to that is when the addiction is the focus for both of you, like, it steals your life too. So can you go have, coffee with a girlfriend and not talk about, the addiction? Can you, whatever, can you do something that, that is meaningful to you, that isn't just recovery work? I mean, I appreciate, but I was talking to somebody the other day and they were talking about, I was doing 7 hours of, betrayed partner podcasts and everything. Like, that's a lot, and you can get, saturated, but can you back it off and have more life? The point of recovery isn't to be doing recovery work 24/7. It's about having a life that is connected in real and meaningful ways. So unfortunately for the partners, it does, it sucks all the life out of both of you. So how can you start, taking you back into the, creating space for you? The addict is on his journey. How can you be on a nurturing path for you? Take up pottery, to go for a hike, whatever it is that nurtures you too. So thank you, Dr. David. Thanks, everybody. Great questions. Thanks for letting me hang out with you tonight. Talk to you soon.
Okay. Bye-bye.
Bye.